This video is designed to give you the information you need to understand the results of semen analysis. I will run through some basic information about where and how semen is made, and then explain how semen should be collected and how to understand the results from the lab. Firstly, a bit about fertilisation. Fertilisation is the process where the man's genetic material in the sperm mixes with the woman's genetic material in the egg. Once this has occurred, an embryo will develop. This embryo will become a baby over the course of the pregnancy. In order for fertilisation to occur, the sperm from the man has to get to the egg from the woman. Sperm is produced in the testicles of the man. Eggs are produced in the ovaries of the woman. Normally, for fertilisation to be successful, they need to meet in the woman's womb. Next, we'll focus on the important aspects of the sperm getting to the womb to allow for fertilisation. Sperm are continuously being produced by the testes. During ejaculation, sperm are squeezed from the testes through the epididymis and vas deferens. As they pass, they mix with seminal fluid from the seminal vesicles. The seminal fluid contains sugar and is an alkaline, the opposite of acid. The sugar is important to the sperm for energy. Being alkaline is important to protect the sperm from the acidity of the vagina. As they pass the prostate, they mix with prostatic fluid, which is a sticky, milky fluid. The mixture is then called semen. This mixture is ejaculated into the vagina. It will pass through the cervix and into the woman's womb. If the conditions are right, a sperm will mix with an egg and fertilisation will occur. Next, we'll talk about how semen should be collected for the most accurate results from the lab. If you are going to the lab to have your semen analysed, you should follow some simple rules. These rules should be provided with your sample bottle. They may change slightly for different labs, and if you're in any doubt, contact your lab for further advice. These rules include: do not ejaculate less than 2 days before the sample is collected. Also, do not ejaculate more than 7 days before the sample is collected. In other words, the last time you engaged in sexual activity or masturbation should be between 2 and 7 days before your sample is collected. The time between the sample being collected and being in the lab must be less than 3 hours. Ensure your hands and penis are clean and dry before collecting the sample. Collect the sample through masturbation. Collecting it through sex or with a condom could affect the results. Make sure to collect the full sample. Any spillages should be reported to the lab. Fill in the form and the bottle with as much information as possible. Keep the sample warm between the time of collection and delivery to the lab. There are several components to understanding semen. These include the total volume of semen, the total number of sperm, the percentage of normal sperm, the percentage of progressively mobile sperm, and the pH. All the results are in the form of a number. This number can be used to compare the results of the sample collected from the man to the results of men who've been able to get their partners pregnant within 12 months of trying. The lower reference range, the number that a man's result should be above, comes from the 5th centile of men who have been able to successfully get their partners pregnant within 12 months of trying. In other words, if you take 20 men who have successfully got their partners pregnant over the last year, 19 of them will have results above this value. Simply, if a man's semen analysis is above this value, it can be considered to be within the normal range. All of the different components are important in increasing the likelihood of successful fertilisation. It is important to have enough semen, a volume of semen, for one sample above 1.5 millilitres is the normal limit. It is important to have enough sperm. A sperm count for one sample above 39 million is the normal limit. It's also important to have sperm that are normal shape and function. A number of normal sperm above 4% is the normal limit. It is important to have sperm that swim well. A number of progressively motile sperm above 32% is the normal limit. It is also very important to have semen that is alkaline. This is to combat the acidity of the vagina. This is measured as a pH, and it should be above the value of 7.2. And as a final note, there are many factors that affect fertility. Semen analysis, as discussed, is only one factor. The woman's fertility is equally important. There is also the aspect of luck. There have been men whose semen is below the limit discussed above, who have fathered multiple children, and men who are completely above the limits who have been unable to have children. The results of semen analysis should be taken with caution and can only be used as a rough guide to assess the fertility of the man.